Well, good morning. This is Mark Ittleman, speech-language pathologist, and welcome to the teaching of talking. Today our little video is going to be about making it easy when it deals with aphasia and apraxia therapy. Now, I've said that many times to therapists, and they look at me crazy, and patients with aphasia and apraxia look at me crazy, and they say, oh, no, aphasia and apraxia therapy is the hardest therapy, is the most frustrating therapy. I don't believe it. I had a letter from a woman who had aphasia who read that, and she said, you're crazy. And, if you know how to do something, and if you can teach that thing in a simple way, people can learn it. Now, I had a really hard time in geometry when I was in school. And I had this teacher who taught me I didn't like him at all. And, I just didn't learn from him very well. Okay, and I didn't do well in that class, and I had to take that class again a second semester, the same class. And guess what? I got the same teacher, and guess what? I got the same results. Now, the same thing applies in aphasia or apraxia therapy. But by the way, I then I got a different teacher who taught me the principles of geometry in a very, very simple and easy way. And I got it just like that. Now, it's the same thing goes with sports teams. You have sports teams and you have a coach. Okay, so with the team members, you have all this expertise, all these players who are great players, but why does one team win and why does one team lose? Well, it's all in the coaching. It's all in the coaching, and if the coach can make it fun, and if the coach can make it pay off. And that's the problem. There are a lot of coaches, whether they be in sports or whether they be in teaching or whether they're in therapy or whatever it is, who just don't make the whole process of doing it very easy. They don't make it fun, and it ends up being a task. It ends up being frustrating, and speech therapy should never be frustrating, ever. If you have a good therapist, the therapist should be able to look at that person, listen to their speaking, and come up with a couple of solutions, a couple of small things that can be practiced at home, a couple of small things that can be shown to a caregiver, a couple of small things that can be done. And, they're always able to do it because the therapist makes sure there's something called stimulability. And what a therapist does when, a good therapist now, what a good therapist does when choosing an intervention, choosing a therapy method or a maneuver or a technique, is he or she looks at the person and listens to them talk and can ascertain in a very, very short period of time what that person can do and what they can't do. And so you start out with what they can do, and you just gradually make the task a little bit they make the task a little bit different, and they make it a little bit more difficult. And the person, since they're improving, the person with aphasia or apraxia has more confidence, and the caregiver has confidence. So you start out easy, you start out simple, and then you start just adding little changes to their routine. And of course, you encourage them to follow the discipline of practice every single day, because speech, when a person has aphasia or apraxia, quite often, almost the whole process disappears. Almost the whole process breaks down, and you have to almost start at the very beginning. And so a lot of therapists, a lot of loved ones think, well, we need to start talking in sentences. Why aren't they talking in sentences? Well, because they're not at that level. Sometimes we have to take them all the way back to a sound level, of vowels and simple sounds. Sometimes we have to work on that first so that they can learn how to get control of the tongue again, the lips again, the throat again, the teeth again. So this is just a little bit of a message for you about aphasia and about apraxia, that it can be easy. And I attest to that, okay? I attest to that. And if you have a good therapist, a nice therapist who knows what they're doing, they can help you help your loved ones speak better, because they'll give you simple little things to do that you'll be able to do and they'll be able to do, and then they'll feel confident, the patient will feel confident, everybody's happy. So that's the message for today. Speech therapy for aphasia and apraxia can be easy. And down below, if you want to join us on our Facebook page, there's a link there to our web page. There's a link there. If you want personal one-on-one mentoring, there's a link there. If you want to join a class that we're having, where I'll mentor you in the class, we have about 8 to 10 people in that class, and it goes for about 2 hours, and I spend about 15 or 20 minutes with each person on the call. And you can also learn from other people. And, we have independent study, online video course, and we have our new book on apraxia, and we have another book on aphasia. So there's no excuse at all. There's no excuse at all. And take the idea that speech therapy for apraxia or aphasia is hard. It's not hard. It can be very easy. But the key to successful therapy is the discipline of doing those little things every day, because it's those little things every day that pay off. Okay, thank you. And if you like this video, please give us a thumbs up, and we hope to see you soon. And of course, as I always say, not always, but most of the time, I hope you have a good day today, a good weekend, a good week, a good month, a good year, and of course, a wonderful lifetime. Bye-bye now.